Tutum. It's good to have you on this program, Future Ambassadors. I'm Omotola Adokayo Gundele. Today we're looking at drug abuse among young people. We cannot stop talking about drug abuse. It's something that we've had is part of us in our society now. So with me today in this program, I'm having some lovely guests that will be telling us more about drug abuse. I'm having youth in the program. I'm having Uyinkosola Balogun. You're welcome to this program.
Thank you, ma'am.
And I'm having Waliyat Unisa. You're welcome to this program.
Thank you, ma'am.
And I'm having a professional that will be telling us more about drug. I'm having Deputy Superintendent of Narcotic, Bamishayi Fumilayo. You're welcome to this program, ma'am. It's good to have you again. Anytime we call you, you always come around. You've been telling us about drug. So we'll continue talking about it until we see positive changes in our society. I think so.
Yes.
Okay. So now let me go to the youth who want to know what actually is drug, if they actually understand what drug abuse is and the difference between normal drugs and abusing drugs. Okay, now let me go to you, Oyinkosola. What actually is drug to you?
Drug are any substances that we taking maybe to cure any maybe any issue, maybe you have any problem, maybe we are sick or headache and something like that we taking to cure the sickness.
Okay, let me worry out what is drug to you? Drug abuse.
Drug to me.
Drug, not abuse now.
Okay, drug to me is a chemical substance that we take into our body to improve our health.
Okay, then when do we now say it is being abused?
When it is when you take the excess, like
Of
when
the
you
drug.
take the excess of the drug.
Okay.
Apart from the prescription given by the doctor or a physician.
Okay, let me go to Madam. Madam, what actually is drug?
Yes, there is there can be an end to this conversation because it's an ongoing problem, and until, like you said, until we see the end of it, we won't stop talking about it. Now, drug can generally be defined as substances, be it in its natural form, synthetic, or in any form whatsoever, liquid, solid, or gaseous, which when exposed to an individual could affect perception, behavior, or thinking pattern of an individual.
Okay.
It can also be any substance that can alter the way body functions. Now, you may begin to wonder, how is that? There are some substances we take for social purposes that when we get exposed to it, it brings about certain changes in our body. For example, alcohol. And we also have certain substances that when we take are considered illegal, and their use is highly prohibited because the law forbids it.
Okay.
And we also have substances that used for medical purpose. When you feel headache, you feel feverish, you feel as if you are unable to sleep at when you want to, you go and take certain chemical preparation, and when you take them, they bring about a change in your body. Those are also drugs. So it depends, but we have different categories of drug. So it is in understanding these various definitions that we can now start to talk about the abuse. But generally speaking, any substance, any chemical substance, be it in its natural form or synthetic form, that alters the way body functions is considered a drug.
Okay, sorry, ma, when do we call it drug abuse now?
Yes, now drug abuse also stems from these various definitions. Now, any substance that you use for medical purpose without it being necessary, when it is not considered medically necessary, is called abuse of that substance. Or when you take social drug or substance such as alcohol, for example, and you take in an unacceptable way or excessively. When someone begins to take substances in an excessive manner such that the next neighbor feel threatened or feel concerned, that's an abuse. And also, talking about the legal perspective now, when you have possession or use of substances that are considered illegal, within
Okay.
the law, it's also called an abuse. For
Okay.
example, cocaine, cannabis, igbo, what we normally call
Before you
igbo,
start
and the
telling
rest.
us more about
That's
the
abuse.
names of these drugs, I want to hear
Yeah.
from the youth. Do you know? Tell us some of the names of these drugs that you know about that you might not be taking, but you've seen people take it. And
Molly,
okay,
weed, ice. Yeah.
can you explain more to us? At least you are in school environment,
Yes,
so you
ma'am.
should know more about these things.
Though Molly, some people take it. Maybe they are sad. They take it in maybe like happy pills.
Happy
So they'll be
pills.
happy. They
Okay.
consider that if they take the molly, they'll be happy. And the weed, maybe they are sad or they are maybe they are depressed.
Okay,
So
Okay.
to just wipe up the sorrow or depression.
let's hear from Waleat.
Like ice, molly that she has said, and weed. I think the molly, most of them they will be like, okay, since I'm not happy, or just to for that very moment, just to take them away from the pressure around them. They'll
Okay.
just take it, and even this weed, they just get eye on it.
Okay, so why do young people do that? Why do they get involved in that?
Mostly, I think it's peer pressure. The people you roll with, the people you are around, and mostly people you get advice from.
Okay, so let me go to Madam. Please, ma, let's hear the professional voice, the voice,
Perspective.
yes, for these drugs that we have outside, mostly in Nigeria, that are harmful to youth.
Yeah, talking about the commonly used substances in our society, especially Nigerian society. It is sad to say that every day new variation of
Comes
drugs
out.
are coming out.
How do these people discover it? Especially this young, how do they discover
it is more or less like, as we are researching into how to put an end, you used the word curb earlier on, you are looking at a way to tackle this problem by way of legislation, by way of enforcement, awareness creation. They too are carrying on some clandestine investigation and research with intention to invent new variety of drug, with the sole aim of evading prosecution or detection, and without bringing about a kind of reduced effect of those substances. Because why? They want to keep the users hooked to the habit. So we have substances such as cannabis, like they have pointed out. That is an age-long natural stimulant
Okay,
that is being abused or being commonly used in our society. It's a natural plant that
Okay.
they plant, and it grows, and then they harvest it and bring out different varieties. That's where they have molly, they have
Okay. The smile, what do you call it?
no,
Happy pill.
smile is different. That's a designer drug. The happy pill is a designer
Okay.
drug, actually. Now we also have some synthetic analgesic,
Okay.
like tramadol. I'm sure you guys must have heard about. It's commonly abused now, and NDLA make arrests in their tons every month in the country, because they find it lucrative now, and the criminals are bringing it in. They are inventing new ways to cover up and perpetrate this evil for financial gain.
Okay,
And then we have the current one, actually, that our chairman chief executive, retired Brigadier General Buba Marwa, have just given a directive on its clampdown. Is called laughing gas. Laughing gas is a sedative, sort of a depressant, which is originally meant for a medical procedure. Our dentists, our medical doctors apply it to patients to sedate them or to reduce the pain they experience in the course of a minor operation or surgeries. And people now devise a way of commercializing it with intention to sell it to people who will abuse it, who will use it for pleasure purpose, something that was meant for medical purpose originally. Now, we have cough syrup and the rest. We won't want to inform people who don't know about it, so we would like to. They write, and we have unconventional substances that are common things being used in our kitchen, around the house, for ornamental plants, that they now know how to add one or two items to, with intention to create a kind of pleasure feeling when they use them. And they have various ways of using them. Some smoke, some rub it on the body, some they just perceive the gas, okay? Some drink it, some make it into food concoction. And the sole aim is for it to give them a kind of unique feeling, which is considered an abuse, because it's a deviation from its original use.
Okay, now you just said the NDLA do get these people, and I don't know, but still we still have a lot of people outside there that still get involved with drug. Is it that they are reducing people that are being caught? What happened to them? How long they spend in detention? If people knows about this, they might hardly get involved in drug. So let's know about the procedure. Did they stay long in the detention? Did they pay fines? Why do we still have more people getting involved in it?
Thank you very much for this question. It is an important question because we get to hear people complain on radio all the time as if NDLA is not working, but thank God for the new leadership of NDLA, led by Brigadier General Buba Marwa, who is doing all within its power, leaving no stone unturned, to creating awareness, empowering the enforcement activity of operatives of the National Drug Law Enforcement Agency. There is no day that passes without news about arrests, massive arrests being made in their towns, okay, that are being made. We have never had it this wonderful. The effort is glaring and cannot be denied, okay. But you see, to come to your question, why are people stealing? The knowledge that people are being arrested does not deter these people, because there is a massive profit in drug crime. It's a multinational crime.
Okay.
It is a syndicate that cut across borders and nations. It is deep, and it is more worrisome since the COVID-19 epidemic, because we now have what we call dark web, where people go using the global information platform to perpetrate this crime in order to evade detection and arrest. So it is complex. It is a complex thing, and it is I think it is attractive to those criminals because of the economic gain that is in it. So sometimes they don't even care if they are arrested. Their eyes are on the profit they will make if they succeed. And that is why we are trying to create awareness for our young ones who are at a high risk of being used, being recruited into that nefarious activity, because they are the soft targets actually by these criminals.
Okay, before I move back to the youth, I want to, recently I think you people had your day,
the UN Day celebration.
Yes. So can we know about that, the team,
yes,
has it really made any effect on the society?
Yes, annually the United Nations Office on Drug and Crime has its day set aside for the celebration of a day set aside to create awareness and sensitize the public against drug use and related crime. And this year it usually comes up every year on the 26th of June. Now this year's theme is on people first, stop stigma and discrimination, strengthening prevention, because a lot of people are into drugs, not out of their own volition. They don't want to go into it. She mentioned something about peer pressure.
Yeah.
A lot of youths come from home into tertiary
Innocent children,
institution without the knowledge about how they get lured, they can possibly get into the habit. Some out of curiosity, and sometimes some people don't even know the dangers inherent. They only know the short-term benefit of use of those substances. For example, someone who is using cannabis, what we call igbo, maybe looking at the stimulating effect of cannabis, they may think it emboldens them, it gives them courage and all that. But
Especially those in
excuse
school.
me, nobody told them that the delta 9 tetrahydrocannabinol content, chemical content of that substance has a long-term effect on their fertility, on their heart, on their vital organs, on their mental health, possibly. Though that also depends on individual health, individual predisposing factors, and body makeup. For some it may not affect them, but for a whole lot of others it could have a long-term effect on their well-being. People don't tell them when they want to get them hooked on the substance. So this, and then when we begin to ridicule people who have problem with drug use, we make it more
difficult
for them to come out and seek help. So the UN is calling everyone's attention to the fact that being into drug does not mean that you cannot be useful and that you cannot get rid of the habit. You only need to access help, and we should, as a community, make it easy for these people to access that help.
Okay, let me go back to you, to Oyinko. Oyinko, how have you seen people on drug? How do they behave?
Yes, ma'am.
How do they behave? How do you see them behaving?
They behave as if they're on top of the world. Like those that are not taking drug, maybe they are below them.
Okay.
They behave. They not behave normal. They behave abnormal. Like
And they want to get more. I think.
yes. They
Let me hear
want
from
to get more.
Waliat.
They behave violently, like even their neighbors are always having the insecurity that this guy, when he's on drugs, you can't just know that you should just stay away for that moment,
Okay.
because that's what I think, and that's what I've seen.
Okay, these people
There's
that
insecurity there.
get involved in drug, what actually can they do? As in just the crime. Okay, you want to say something about that?
Yes, on that note, this is what we are talking about, stigma. Now, people look at people who use drug and believe that they are a no good, wasted people. They are criminals, they are harsh. But I must shock you, not everybody who use drug exhibit
That traits.
those traits. We have grown-ups who use drug
And
and
nobody
still
knows.
don't show the or exhibit any sign. They still function normally. Actually, a very minimal percentage of people, for example, the world over, we have around 275 million people who use drug around the world, based on the national statistics made available in 2018. 3 million out of 275 million come down with symptoms.
Okay.
That goes to show that it's not everybody that use drug that usually exhibits that kind of traits.
Okay.
But it also depends on the field they've been
Individual, I
exposed
think.
to.
Okay, yeah.
But that does not mean, or that is not a kind of endorsement for drug use. No. We are only saying that individuals respond or react
To different
types of drug being used. For the person that is considered erratic and violent after a use of substance, we need to consider his temperament, his makeup, and the substance being used. For some people, you may see someone who will be
calm.
very, very calm and withdrawn. It depends on that person may possibly have been exposed to this present substance, whereas the one that is erratic and violent may have been exposed to stimulants of high dosage. And sometimes when people get exposed to different types of drug at the initial stage, they are not detectable, which goes to say that your next door neighbor may have been using and you won't know. For a long time, it takes different stages and different procedure. It takes different factors for someone to exhibit drug use habits. Now, it is important for us to know that people with drug use problem deserve attention, just like people with other degenerative sicknesses. For example, diabetes, high blood pressure, HIV, and the rest. The way they need Medicare in order to overcome or manage their health challenges is the same way that people who use drug deserve our compassion. When you have someone who is suffering from high blood pressure, you don't just write them off and say he will soon die.
Sure.
The same way we should look at people who use drug in our communities, in our neighborhood, that look, this person should not be written off or be avoided. We should only help them to seek help, to get better, and for the benefit of the whole society.
So let's look at what actually the government is doing to curb out this issue.
To curb the problem of drug use. The federal government is leaving no stone unturned. For example, of recent, the legislation that is empowering NDLA to do what it does got reviewed, amended, to give more teeth for NDLA to do the job it was initially constituted to do. Now, NDLA, being led by the current leadership, is reaching out to more collaborators, more stakeholders to come on board. And the media is an important tool in that regard, and we appreciate you for all you are doing. You provide us platform to talk to the public, create awareness, because knowledge is power.
Yeah.
And when you know the source of a problem, it is half solved.
Yes.
And more so, our NGOs are also coming up to collaborate with us to create events and get us invited to come and talk.
Sorry, ma'am, because we are not having much time. So if it is not taken care of, what do you think it can lead to?
Crime will keep on
Increasing.
Even a situation whereby they are not feeling insecure, like they want to get anything they want just to get that drugs.
Even
us,
parents.
yes.
What do you think parents should do? Because we don't have much time. I want to hear from you.
They should.
Parents will continue advising the youths, and sometimes advice does not solve it all, but we the youths, we help ourselves. Like if I have a friend doing it, I will just tell her or him that, oh babe or guy, what you are doing is not right. Counseling, like getting closer to the person, telling him or her that, okay, this is right or this is not right, or moving closer, not moving, okay, because he or she is taking drugs, I should move away from the person.
Okay.
I think it will help them a lot.
Okay, let me go back to you, ma'am. So now, if we don't cover out this thing, if we don't stop it, if we don't make way to come out of it, what will it lead to?
Yes, drug problem is an international problem. Because not that everyone using drug is a criminal, but it has the potential of leading someone into crime. For example, like she said, in order to feed the habit, when someone is into substance use, they can do anything to source for fund to finance the habit. Okay? And also, most importantly, health-wise, and as such, NDLA cannot do it alone. We need everyone to come together to support NDLA to execute its fundamental duty. Thank you so very much.
Thank you for coming, and thank you, Bia Satomu, for being there. You've heard it from our guests in the studio, and I think with this you should work on it. And people that feel it's none of my business, what goes around comes around. So until come your way again on the same program next week. Bye bye.